So one common pathology that we see is something called a SLAP tear, or proximal biceps degeneration. Now, that's something that usually will show up on an MRI, but sometimes it doesn't, and it's more of a clinical diagnosis that we find on the exam in the office. Now, what that is when you look at the shoulder, there's the ball and the socket, and your labrum surrounds this area on the socket. Think of it like a rubber washer or a gasket. Now, one of the bicep tendons comes up into the shoulder and inserts on the top of that labrum or gasket. And you can get a tear right where that inserts. Usually it kind of goes this way, or you can get some degeneration or wearing of that tendon as it comes up, which is a big thing that can cause pain inside the shoulder. We can talk about different types of tears and things like that, but usually treating this is something we can do surgically. We go in with an arthroscope or a small camera, cut the tendon right here, and either let it fall back down the arm or spot weld it further over, so once it heals, when the biceps pulls, it's pulling on a solid anchor instead of on that crack and causing pain. We can talk about recovery as well as other options besides surgery for something like this, but it's a common pathology that we see a lot.